Hello everybody, I'm Abdu and I would like to answer CASP questions. At first, are the results of the trial veiled? Beginning in looking at the result, we find veiled. First question, did the trial address a clearly focused issue? Yes, it was noted that the experiment focused in renal outcomes for patients with high blood pressure by comparing therapeutic intervention between Amlodipine and Ramipril. Question 2. Was the assignment of patients to treatments randomized? Yes, Americans with hypertension aged 18 to 70 were identified and participants were randomized assigned. Question 3. Were all of the patients who entered the trial properly accounted for at its conclusion? Yes, the analysis lasted for 3 years with patients in the randomly selected groups. Is it worth continuing? So far, we can say that the work is worth continuing. Question 4. Were patients, health workers, and study personnel blind to treatment? We can't say. This aspect is not discussed in detail during the study. Question 5. Were the groups similar at the start of the trial? We can't say. Similar groups have been applied in age, disease burden and history, but no gender is mentioned, male or female, social class, social influences, and lifestyle. Question 6. Aside from the experimental intervention, were the groups treated equally? We cannot say that. They were treated equally in all matters such as social matters or way of communication because the duration of the study is 3 years and the method of treatment are not mentioned in detail, but we can say that they were treated equally in the therapeutic intervention. Section B. What are the results? Ramipril compared with amlodipine retards renal disease progression in patients with hypertensive renal disease and proteinuria and may offer benefit to patients without proteinuria. Question 7. How large was the treatment effect? The result was clearly defined. The Ramipril group had a 36% lower and 48% lower risk of clinical endpoints versus the amlodipine group. Question 8. How precise was the estimate of the treatment effect? We cannot say because the limits of trust are not mentioned. Was the right result actually obtained only because of the intervention, or was there another reason such as a change in lifestyle? Section C. Will the results help locally? Will help but limited. Question 9. Can the results be applied to the local population or in your context? No. Sometimes the volunteer group does not necessarily represent the entire population of the country. We cannot say that the group tested was quite similar socially with the local population, because there are several differences, including difference in lifestyle, social class, economic, and psychological.